Hello, everyone. My name is Gary Baumgarten, but I suspect you already know that, and I welcome you to this discussion on Facebook Live, on paltalk.com, and on YouTube. Well, there was another hearing today in New York State about the COVID, about the patients who were trapped inside and who were subjected to COVID because they moved COVID patients into the nursing homes to relieve the pressure at the hospitals. And thousands of people died needlessly as a result of that policy. And also, we're hearing now about the policies in the nursing homes that left a lot to be desired. And we are pleased to welcome back John Dolly of Dalli and Marino, attorneys at law in Long Island, New York, who specializes in elder abuse cases and who watched the hearing for us today. And I think you actually submitted some testimony in writing. John Dolly, welcome back to this discussion on Facebook Live, paltalk.com, and on YouTube.
Thanks, Gary. Good to be with you.
So we've heard there are two hearings so far. I don't know if there's a third scheduled, but what we learned at the first hearing, we heard from the patients' families, family members. It would break your heart how you could watch that without getting your eyes watery. Is unbelievable how their loved ones were subjected to the COVID, exposed to the COVID. They can't go inside. They can't be with them. In a lot of cases, people died alone and lonely, and their children and grandchildren were on the outside of the building looking in, not being able to hold their hand, not being able to be there for that end of life experience, which we all know is so very important. And now we're hearing that the nursing homes are perhaps just as culpable as the state government in New York State.
Yeah, absolutely, Gary. The hearings took place last Monday, and today they were broken down into an upstate and a downstate category. And like you said, there was testimony from numerous family members of residents of nursing homes telling horrific stories about being lied to, about whether or not there were COVID positive residents in the facility, stories about family members being placed into rooms where there were COVID positive patients and contracting the disease, and a complete lack of communication between the nursing homes and the families about what was going on, about the health status of their loved ones, and what they were doing to protect them, which in most cases was nothing.
And I actually learned that in some cases there was not just a lack of communication. Sometimes the nursing homes downright lied to the family members.
Yeah, there have been documented instances of family members who, some of whom testified under oath today during the hearings, who were basically lied to about whether or not there were COVID positive residents in the facilities, and lied to about the infection control measures that were being undertaken by the facilities to help protect these residents. And unfortunately, this speaks to a problem and a number of problems that have been going on in nursing homes for years. COVID really just shed light on a series of problems that has been ongoing, most of which relates to understaffing at these facilities, and unfortunately the owners, particularly at for-profit facilities, caring more about the dollars in their pockets than the residents in their beds.
Well, I happen to know some people who work in some of those nursing homes and extended care facilities. And I know that they are extremely frustrated. The ones I know are very caring individuals. They are overworked. Some of their colleagues never returned to work when the COVID broke out because they were afraid, and understandably so. So they have to shoulder the responsibility of having to handle even more patients in nursing homes that many of them were understaffed to begin with. And now some of them are saying that they feel very hurt that when the state of New York was accused, and correctly so, this is a factual statement, of taking COVID positive patients and transferring them from hospitals to relieve the pressures in the hospitals to the nursing homes. The defense, and we just heard it today in an interview or a statement that the governor made. I just read it in the New York Post this morning. He said, well, no, it had nothing to do with our policy because the COVID was already existent in many of these facilities. It's the staff members who brought it in from the community, not the patients who were COVID positive who infected pre-existing patients in the facilities. They're very hurt by that.
They are, and it's really an indefensible position. The governor and the Department of Health in the state of New York have stuck by their story now for months. And basically their argument is, which has been now supported by two separate reports they've issued, is that the peak of deaths in nursing homes occurred approximately 1 week after the March 25th order directing that nursing homes accept COVID positive patients. And they use this fact as the support for their argument that this decision did not contribute to the over 6,000 deaths that we had in the nursing homes. The workers in the nursing homes, the RNs, the LPNs, the CNAs, these are very dedicated workers. They're underpaid, they're overworked, and to hear that they are being listed as the source of the spread in the nursing homes, even though it's through no fault of their own, says the government, is very hurtful to them. And the fact is today that we heard testimony from a number of workers at facilities in both downstate New York and upstate New York who testified that not only did they not have PPE, they weren't trained, weren't told how to use it if they had it. In fact, one woman testified today that when she went to take her break to go to the lunchroom and she saw other workers there who were not wearing masks congregating, and she asked the supervisor, "Isn't this dangerous?" She was told to go outside and eat her lunch outside. I mean, some of the stories you heard today were actually unbelievable. So, the nursing homes didn't do the right thing here, and the Department of Health did not do the right thing either. What the Department of Health should have done was direct that the nursing homes transfer COVID positive patients to COVID only facilities, which the government said they had. And there's still no answer as to why this was not done.
Clearly, facilities were not; those facilities were underutilized, and they closed up shop because they didn't. Well, kind of. They had what they did. In my experience, was they provided off-site facilities, not for COVID patients, but for people who had regular traumas to go to, so that they wouldn't have to go to the hospital. And those were underutilized. They could have taken the Javits Center, where they only had a handful of patients, and make it a COVID-only facility during the crisis, and that would have resolved this problem.
It would have. And also there were COVID-only nursing homes that were designated as such by the Department of Health that could have taken on COVID-positive residents. But, we have to understand that for every person, every resident that a nursing home loses, they lose revenue. And you can't but help think, particularly at these for-profit institutions, that they were concerned that for each resident they transferred out due to a suspected case of COVID or a documented case of COVID, they were going to lose revenue. So they held on to them, but they did not provide the protection, the infection control, didn't arm the staff with what they needed to keep the staff safe and these people safe. And that's why we ended up with 6,000 plus deaths.
Well, John Dolly of Dalli and Marino law firm in Long Island, New York, you are so kind, maybe because you're used to being urbane in the courtroom, when you say they were listed, the staff members listed in this. I would say they're scapegoated. There's no question, when I talk to people who say not only were they not given PPE, but they got cloth. Some of them made their own in the beginning. They had cloth masks that are disposable, and you're only supposed to use it for a short period of time. If you're wearing it all day, I imagine you would discard it at the end of the day and put a fresh one on. But they weren't being provided with them. They take those cloth or paperish, and they take them home and they try to clean them, and then bring them back to work the next day. So not only were the patients not properly protected, but the staff members were not properly protected. And then you blame the staff members for bringing the COVID into the building.
And don't forget, training with PPE is key to ensuring that the PPE is effective. It's not as simple as providing a mask and a gown to a certified nursing assistant and say, here it is, go use it. Those folks needed to have training. For example, they had a nursing home resident testify today. He was a young man, unfortunate situation, who's paralyzed. And he testified that he would see CNAs come into his room, take care of him, never change a gown, never change a mask, and then go take care of his roommate. So clearly there was no training being done. So even if there was PPE available, the staff wasn't given instruction on how to use it. And again, that contributed to the spread as well. So there's plenty of blame to go around. Unfortunately, nobody wants to take the bull by the horns and admit to it, particularly the New York State Department of Health, who continues to this day to make the argument that the decision they made on March 25th to refuse to allow the nursing homes to keep the COVID patients out had nothing to do with this spread and ultimately the deaths of all these residents. It's just not true.
Well, Health Commissioner Zucker went even further. He kind of refuted the facts that are in evidence that there was such a directive. He during the first hearing, he denied it. He outright denied it. I guess you're under oath when you testify before a legislative committee such as that. I don't know whether there are penalties for perjury or not, and I don't want to accuse somebody of breaking a law. I don't want to be libelous or slanderous. But that being said, my jaw dropped when I heard him say that.
Well, here it is. We've got some political semantics going on, Gary. What the commissioner testified to in the hearing last Monday was that the directive did not require a nursing home to accept any particular resident. It just required them not to discriminate against one who had it. And if they could not care for that resident, then they should not admit the resident to the facility. So in essence, the commissioner was saying that the nursing home had the responsibility to make the call. If they could safely care for a COVID positive resident, they needed to accept that resident or could not refuse admission based on that fact alone. So it's a bit of a subtle distinction. On the flip side of that, the basis for this rule that the Department of Health came up with was arguably the CDC guidelines issued by the federal government, which simply said that you can't discriminate against COVID positive patients or COVID positive residents. There was no directive from the federal government that said a nursing home must take a COVID positive resident. So really what the commissioner was saying is, listen, the nursing homes are private businesses. The state does not run them. We just oversee them and legislate the rules. It was up to the nursing home to say, hey, listen, I can't keep this COVID resident safe. I'm not going to accept him because I can't keep him safe, not because he has COVID. So it was basically the health commissioner punting and saying it was ultimately the responsibility of the facility to make that call. Don't blame us for simply echoing the guidelines of the CDC.
In a society such as ours that is over legislated, where behind you there are law books that are bursting at the seams, your law library, it's just astounding to me that we do not have legislation that protects the patients and the staffs in nursing homes. Now, I will give you a little anecdotal example, and that is when you look at people who cut hair. They have to be trained in how to handle a hazmat situation because they're mixing chemicals when they put dye in somebody's hair. There are all kinds of infectious disease training they must go through first. If there had been communicable and infectious disease training that the nursing homes and their staffs were required to be certified in before they could operate, then they would have known what to do to avoid the transference of the germs from one patient to another. But apparently, from the descriptions that we heard today and in the previous hearing, there is no such certification required.
Well, we do have, in New York State, we have a very large set of regulations that govern nursing home care in the state, and it falls under the New York State Public Health Law. So the issue is not so much not having regulations, although we need new and additional regulations that COVID has made it patently clear we need. But it's the enforcement of those regulations. You're basically in a situation here in New York where the Department of Health is charged with overseeing these facilities, and they just don't do a very good job of overseeing them. So the nursing home operators who are operating a for-profit business are basically free to do what they want. In fact, we had testimony today from two workers at facilities. In fact, one resident of a nursing home who talked about how when the state comes in to do a surprise, and I put the word surprise in air quotes, inspection, that they know they're coming. So they can get everything ready, get their chart in order. So there isn't enough oversight. There isn't enough governmental oversight. There isn't enough staff at the Department of Health to ensure that the nursing homes are abiding by the rules, abiding by the regulations, and providing safe and adequate care. When families entrust their loved ones to a nursing home, that's all they're asking for. They're not asking for superlative care or care that goes beyond reasonableness. They just want a safe and practical environment, a safe environment for their resident, so that they can live their life in peace and get the medical treatment they deserve, to be treated like human beings. And as one of our assembly members said today, who was at the Assembly Member Kim, who's at the forefront of the legislation, the nursing homes look at residents as numbers and data, not as human beings. And we need to change that.
So what are the chances that meaningful legislation as a result? I mean, what greater crisis could you have than 6,000 people dying as a result of these gaps in enforcement and legislation? What are the chances that meaningful legislation will actually be passed?
I'm hopeful. As you know, I believe last time we got together, we spoke about the immunity law that the governor gave to nursing homes and other healthcare providers, where basically negligent care is going to be forgiven or not enforced. Lawsuits are not allowed for negligent care during COVID for as long as the emergency exists. Fortunately, last week, the legislature in New York passed a law repealing that in a limited way, so that negligent care that's unrelated to COVID is no longer covered by this blanket immunity. So we had some success there. And I'm hoping these hearings, both last Monday and today, are shining some sunlight, which, as we know, is the best disinfectant, to show some of the problems that we have in the healthcare facilities, and that we can get some meaningful legislation, particularly in the area of ensuring that a percentage of the monies that the nursing home takes in, particularly from Medicare and Medicaid, is allocated to patient and resident care, and is not allocated to profit, administrative staff, or to other things that aren't related to keeping residents safe. New Jersey has recently proposed legislation doing just that. That's done in some other states as well. So we need to move towards that model to ensure that the public monies that are being used to care for our residents are being used to care for our residents, not to profit the owners and operators of nursing homes.
And finally, John Dolly of Dalli and Marino, attorneys at law, I want to put this in your wheelhouse. What are things that attorneys such as yourself who specialize in elder abuse cases, what can you do for some of these families?
Well, for the past 4 months, during the lockdown, we've all been working from home. And quite frankly, Gary, I've been working more as a social worker than a lawyer, just trying to talk to families and explain to them what's going on, why it's going on. It's very difficult to understand when you have a loved one in a nursing home, why you can't go see them, why you can't get any information from the facility. It just doesn't seem right, and it isn't right. So we're doing a lot of counseling with families, arming them with information so that when visitation opens up, they know what questions to ask. We have a 24-hour hotline for anyone on our website if they want to contact us and they have questions about what to do about anything related to a loved one in a nursing home, to call us. We'll try to give them some advice.
And what I will do is after this is published, both on Facebook and on YouTube, I'll circle back around. I'll put that link down in the comments. So if somebody needs to get a hold of you, they can just as easily as I can. Well, maybe not quite that easily because, I pull rank.
You do, Gary. You do, Gary.
John Dolly and Marino, thanks for joining us and putting this in perspective. Hopefully the next time we come together, we'll be talking about meaningful legislation having been approved.
Absolutely. I look forward to it, Gary. Thank you.